This is Poniskovia, a mother of one. Poni fled violence in the South Sudanese Yiwu region at the height of the 2016 conflict between government and rebel forces. She migrated to Arua city in the northern part of Uganda. The conflict, plus a cocktail of other socio-economic challenges, have not left her the same. Once a week, she has to go to River Oli Health Center for psychosocial support.
The life was really very hard. Because when I was pregnant with him, there's no one who can help me. I'm just alone. It is only my neighbors. They're the one helping me because that time I'm not working. I'm just staying at home.
However, the frequent visit to this health facility has always made her feel out of place. Reports about migrants training the public health infrastructure have lately been rampant. Take an example of Vura Health Center 3, about 2 kilometers from Uganda's border with the Democratic Republic of Congo. A bigger part of its patients are from the neighboring Congo.
So these 5% are the ones who do not stay here. They are actually resident in Congo, seeking services here. Later on, they go back to their countries. You know, our supplies is constant. When we do procurement plan, for supplies, it's constant. We do not usually factor in the issue of the migrants. But it affects one hand of the health supplies. Yeah, that one is affected.
As a district, we follow a policy, and we have the refugee policy, and it's an open door policy in summary, that whoever comes and is seeking for any services is basically free to seek for the services and benefit from it, just like any other citizen of this country. We have a number of partners, and some of the partners, just to say, are even across the border. They actually facilitate our activity, cross-border activity.
The South Sudanese Refugee Association is one of the organizations partnering with the local government to support healthcare access. The community initiative that binds South Sudanese migrants in Arua has been mobilizing resources to boost medical supplies, purchase equipment, and hire medical personnel.
So that's why we thought if we come together, we organize our own communities, because they understand us better than even these people from the UNHCR. And now we are linked to different authority, local governments, just to help them coordinate some of the issues that are affecting the refugees, and then how they're supposed to stay together.
At River Oli, they have built a trauma healing center and contributed to the purchase of a chemistry machine to enable the facility support both locals and migrants. The structure behind me is one of the projects by the South Sudanese Refugees Association here in Arua. And when it's complete, it will be a trauma healing center aimed at curbing mental health issues among the migrants and the locals.
We give information on HIV. We do HIV awareness, sexual reproductive health awareness, cancer. We also give them tips, TB, hepatitis B, stroke C. In all our outreaches, we integrate this. In a nutshell, we offer community health education towards the government programs that we see they have gaps.
We started the partnership, I think, last year. So they have been helping us, trying to improve service delivery in the facility.
In Uganda, mental health services are a preserve of referrals, and they are hard to find in lower health facilities.
Though mental health is key, but we support other sectors where we see gap in it.
Concerning mental health and trauma department, they have given for us a staff which is handling the department. So much as they are trying to build the trauma center, per now we are delivering these services to the communities. When the projects, the construction is done, we shall have a good number of the clients to serve.
At Oli, the initiative is providing a safe haven for refugees to restart their lives and overcome traumatic experiences.
We stayed with him like 3 months. When he realized that he has impregnated me, he ran away. He has been working in Arua hospital as a volunteer. When he ran away, he put my number in blacklist, nowhere to get him. I went and checked for him there in Arua hospital. They transferred me to Sura office. I went there. They really canceled me. They asked me with some questions. I also answered them. They start giving me some advice. Then really that advice has helped me a lot. Also, they are not being leaving me alone. We are together with them. They just keep on checking me.
The work being done by organizations like Sura to assist health centers mainly serving migrant population as well as the locals boosts the quality of services availed.
It's because of the overwhelming demand. There are so many. With the awareness we are doing, the patient number has increased. But then the requisition they submit to the ministry, I think it has not changed. We're also seeing the gap. There's a lot of need in health center force. If the ministry can do that collaboration with health center force, they make them be able to prescribe these mental health medicines.
The mental and psychosocial support as a district, we were handling it that time. This time, we don't have a system that picks out the refugees in isolation. It does not do that.
Sura has really helped me. Yeah, was by that time, if I did not go to them, I don't know how I will live.
There is hope that many other migrants, just like Scovia, will be able to improve their livelihoods and promote good health and well-being. This story was compiled by Louise Shamim and Muganzi Winter Walter with support from CAS Uganda and South Sudan.